Hi, I'm Rhonda Barkus. I am the Community Program Manager for the Minnesota Path to Value Project. And thank you so much for taking a little time with me so I can share a little bit about the Minnesota Path to Value Project and bring you up to speed on that. So let me pause for a second so I can share my screen and get that going. So one of the things that you might know is that this was actually supposed to be an on-site, in-person workshop. And it was, of course, we were not able to do that. And so we are needing to do the workshop that you'll be attending. We're doing that virtually. We know that it can be really hard and tiring to attend long meetings over a virtual platform. And so we decided we wanted to go ahead and pre-record some information for you and send so you could watch that beforehand. And that way, the time when we are actually together, it will be very interactive, very engaging, and it won't be you having to sit and listen to education. So that's what we're going to go ahead and send to you in advance. So this is the team, my colleagues that will be working with you on this project: Tracy Morton, myself, Deb Lane, Kim Norton, and Keely Lonetto. So the purpose of this piece of the education is to explain to you a little bit about the purpose of the Path to Value, so that you really understand what this project's even about, and then for you to gain some awareness of all the project work that has happened up till today and up till the time of your action planning session. Who we are. So we are the Rural Health Innovations. We're a subsidiary of the National Rural Health Resource Center. You might have worked with us in the past. We're physically located in Duluth, Minnesota, and we're the nation's leading technical assistance in rural health. We partner with facilities, hospitals, healthcare organizations, other organizations, really focusing on enhancing the health of rural communities. So the Minnesota Path to Value project is funded by the Minnesota Department of Health, Office of Rural Health and Primary Care through a Flex Grant. And the Flex Grant is used to support critical access hospitals across the state of Minnesota. So we started this program, we did the first launch back in, I think it's about December of 2019 or January 2020. And we opened it up for critical access hospitals to apply to be a participant in the project. We had these 6 hospitals you can see on the map that applied to participate, covering Minnesota from north to south, east to west. So a really nice representation of Minnesota. So a little bit about the goal of this project. What is this Path to Value even about? So the Path to Value is really focusing on helping the hospitals who are participating to identify a population that they want to try to impact. So it might be a certain chronic disease in the community that's really very challenging, or that the community is seeing a lot of in their community. It might be a specific population, like an underserved one, or it might be maybe the elderly. So the population the hospital decides to work with is really dependent on the need of that community. So the goal then is, once we know what population the hospital wants to address, the goals are 3. 1, to adopt and sustain an integrated clinical and community-based care model that really supports this population. And then looking at ways to engage the community in collaboration. And so, for instance, if a hospital decides that they're wanting to address diabetes in their community, well, the hospital only has so much influence and so much impact on that. And so we're really looking at who else in the community might we partner with. Maybe it's the school systems, maybe it is faith-based organizations or businesses or restaurants. So who else are we going to engage with to help us to impact, for instance, diabetes in the community? And by doing those 2 things, then we will be able to improve population health. So this is the focus for this 5-year project. This is the Minnesota Path to Value project. Again, it was 4 steps in 5 years, starting with the hospital really looking at their own care coordination services, making sure that the The care coordination is as tight as possible, seamless, and easy for patients to navigate. And then once the hospital feels good about their care coordination services, then we're going to be able to move up that mountain by creating more community collaboration, integrating health into our community, and then making a long lasting change for impact. So this is the way we go. So the first thing that we did is back February 25th. So again, remember, this is February, this is pre-COVID. So February 25th, the hospitals all attended a kickoff webinar where they got to meet each other, they got to find out about the project, we laid out the timeline, which had been created for all 5 years. And the hospitals also had identified a champion. So the champion is the person who is working on the project that kind of serves as the liaison between RHI, who I work with, and the hospitals. The champion is responsible for keeping the momentum going of the project, getting the right people on board, communicating with the leadership in the organization. So it really serves as almost that project manager. And so, as I said, we had all 5 years planned out, and you know what they say about the best laid plans. So this was our original work plan. First year was just going to be about getting going on the population, the care coordination planning, and starting to do some peer sharing call. The hospitals were already going to be implementing some of their strategies, and we were going to be doing webinars. And then, of course, everything came to a screeching halt in March. Clearly, priorities changed. So the hospitals, we paused on this project in March. The hospitals focused on the things that most importantly needed to be focused on. We just kept in touch with our 6 hospitals and said, okay, let us know when it feels like we're ready to get going again. And so then in June, a lot of the hospitals said, okay, I think that we're going to be able to get going again pretty soon on this. So we picked up. So I say all of this to show you that we had a plan for the 5 years. Everything's changed. And so we are flexing that plan to work with the hospitals where you all are, because we know that we might get some really good momentum going and then we need to pause again for a little bit. So we are really changing our mindset about the project timeline. So we're not able to say this is exactly what we're going to do every year, because so much is going to depend on the situation. But I do want you to know where we've been so far. So kickoff webinar February. In March, the hospitals all received their profiles. The profile was a report that was done for each community that talked about some of the statistics and the data in that community. Things like different chronic illnesses. What is the prevalence in that community? What are maybe some of the underserved populations? What are the health disparities? Some of the issues around whether, maybe looking at population, whether the population's getting older in that community. So a lot of the data around the community. So the hospitals received those in March. And so with that profile and the community health needs assessment, the plan then is for the hospital to decide, okay, for this project, what is one population we are going to laser focused on to help move this population towards population health. So in July, we picked up again, July 21st and 22nd, had a virtual workshop. Again, this was supposed to be in last March, and it was going to be in person. But we did the virtual workshop. And this is where a core group of folks from your hospital, usually there were maybe 2 or 3 people, attended, and all the hospitals set their 2 and 3 attending for the virtual workshop. So we were all together. And during that time, that is when that core group began to do some of the early planning for the project. And I'll share a little bit more about that with you in just a moment. But this was really just that core foundational planning. Then what you will be attending is the virtual planning events, and those are all happening for all the hospitals fall and winter. And during those, this is where you're going to get to hear from the core group what their foundational thoughts were, but you're now being brought to the table. And so you're going to have some input into what they were seeing and thinking. So let me show you what they did in the virtual workshop. There were three main questions we wanted answered in that workshop. The first one is, the core group came to the workshop with an idea of what their population might be that they were going to focus on. So they started planning out what's called the care canvas, care coordination canvas. They started doing the original work on the care coordination canvas to say, okay, what does our care coordination look like right now for our hospital around this population? So that's what they did. They worked on that. And then they started talking about, okay, if we're going to work on this population, and we know that this is what we think about care coordination for this population, but who are the other partners that need to come to the table who have more of the story? And that's where many of you were invited. If you weren't part of that before, that's why you're here now. Because in that original discussion, that's when they said, you know what, we need to have so-and-so here as well, because that person deals with this aspect of care. And so that's when they started to kind of flesh out this theme, and that's what brings you to the work you guys are going to be doing soon. And then the other thing that they did is they thought about, okay, well, what is our preliminary vision for this project? What would we like to see happen? What would success look like? So again, they did just some of the seed work for you in the virtual planning that you're going to be a part of. This core team is going to present to you, this is what we've come up with. What do you think? Does this make sense? What are we missing? And so you're going to have the opportunity to give some input to really help kind of build out this care coordination canvas. So after you attend the action planning session with your virtual action planning session with your team, after that, then the hospital teams will begin to implement the plans. And you all will be creating that plan with some of those timeframes in the workshop that you'll be attending. You'll start implementing, and then the next steps is early 2021, we will start doing twice a year peer sharing calls. And this is where the 6 hospitals will come together and will, again, virtually, it'll be just an hour-long conversation around the projects, how things are going, what are you struggling with. And then the hospital folks can all share with each other ideas, suggestions on how to overcome barriers, or, oh, this is what we did and this really worked well. But that's the point of the peer sharing calls. We will also be offering educational webinars, and those topics will depend on what we are hearing from you all that you need. And then also the hospitals will have the opportunity to have individual progress check-in calls where they get to talk a little bit individually with us about what's going on, what are their plans, what are their next steps. And we can sometimes give suggestions for, hey, have you thought about this? Or this, if you do this, this might help to get the momentum going. And then the plan is in fall next year, so it's almost a year away, we would do a community partners workshop. And this is where, if it is at all possible to come back together in person, we will do that, because as convenient as it is to do these things virtually, that's just cannot, to me, it doesn't beat being able to be in the room together and network with each other and really have some good conversations. So if we're able to do that safely in 2021, we will. If not, we will plan and do it virtually. So again, all of this is very flexible depending on our world. So here are our names, our phone numbers. Again, I'm Rhonda Barkus. Here's my phone number, my email. So if there was something in this kind of more orientation presentation that you didn't quite understand, didn't make sense to you, please feel free to call me or email me. I'd be more than happy to talk this through with you, just so that you feel more prepared for the action planning session that you will be doing with the rest of your hospital team. So again, thank you so much for listening. Thank you for the work that you do. And we really look forward to getting to meet with you all in the next virtual workshop, and really get forward to hopefully someday getting to see each other in person. Thank you so much, and let us know if there's anything that you need. Thank you. Bye-bye.